right? I know. So it's been a long while. I totally understand, and that is pardonable, right? So in today's video, I'm going to be starting a new series which includes discussing my PCOS journey with you all, right? So as you've already seen from the title, I'll be telling you how I got pregnant even amidst having PCOS. I know a lot of you don't know what PCOS is, and personally at first I have never known literally like in depth what PCOS is, but you know now circumstances of life will just throw you here and there, and which will eventually make you know a lot of things you may have never known or heard of, right? So that is what I'll be sharing with you all in my video today, and this is from my personal experience, right? So let's dive right into the video. So in this video, I'll be sharing my experience with you all, my subscribers and my viewers, especially on how I got pregnant even amidst having PCOS, right? So let's start the story or the gist or the journey. This is going to be an entire series which includes sharing with you drugs I took while treating PCOS, right? Hospitals I visited, even while I was in search of solution to my problem. And it's because I had PCOS that was the reason why I could not take in and get pregnant as at the time when I wanted it, right? I will also be sharing with you my experiences, series of tests I had to run even while treating PCOS. Thing to note is that a lot of ladies, myself and other ladies inclusive, I'm very sure, do not know that they have PCOS. And if you have PCOS or if your hormones are not balanced, the ability to conceive is 50-50, right? The ability to get pregnant is also a 50-50. This is humanly speaking, medically speaking, because everything is possible for God to do, right? So now a lot of ladies have PCOS, a lot of ladies have hormones that are not balanced, and this is actually one of the reasons why they are not able to conceive, right? Amidst other major issues, right? Now, some of these ladies have obvious signs and they still don't know and still don't pay attention to it, and you wouldn't blame them, because I think when it's time for you to actually get what you want and it's not forthcoming, that is when you now start going in search of the cause of the problem, and then also making an attempt to find solution to the problem, right? Yeah, so this was my situation and this was my condition. So before now, I've not heard of the word PCOS. Before now, I've not heard of it, right? And even the word hormonal imbalance as well, I've not come across it, I've not heard of it, I've not gotten myself involved in any conversation or anything that would make me realize what this thing is or how it's my business, right? So how was I forced to know? My situation, my condition, my experience made me realize what this thing is, right? So now let's dive into the experience, because this is more like a story time based on my personal experience. So let's dive right into the experience. So I've been married since 2020, right? And you know, as newlyweds, you always want to enjoy your marriage, explore your marriage, experience your first year of marriage. For some people though, experience your first year of marriage, explore, just have fun when you've gotten married, especially that first year. So that was my condition, that was my experience, that was my environment, 2020. Then fast forward to the end of 2020, right? Sorry, that was 2020. Then 2021, everybody expects that once you're married, the following year or even that same year, you should start talking about bearing kids. And that was me at that particular time, because people just talk. So a lot of people they're like, school, we've not heard anything yet. Are you pregnant? When are you getting pregnant? When are you this? When are you that? As if I don't understand. So that was the whole situation and condition at that point in time. Everybody kept on asking, and you people don't know that when you ask some of these questions, you don't know if the person you're asking this question has made a conscious effort to try and take in or get pregnant or conceive and it's not forthcoming, or if the person is ready. You don't even know if the person is ready to be pregnant yet. You don't even know anything at all. You just open your mouth, wow, and just start saying anything. And I think I should just be correcting some things even as I'm doing this video. Please, when people get married, except you're that person's sister or brother or parent or close friend or anything, don't open your mouth and start asking them questions, because you're not in their plan. You're not their next of kin. In fact, if you're not their next of kin, there's no point of asking them questions based on when they decide to give birth or when they don't decide, except the person opens up to you and then tells you, hey, you can now give advice. But excluding that, please just mind your business, right? So 2021, I've made conscious efforts to get pregnant, right? You know how we ladies will calculate our fertile days, and we've been following this up consistently very well, and nothing was happening. So it was at that particular point that I got scared, and my partner was quite worried, and we said, okay, fine, before it gets late or before it's prolonged, let's just go and run tests and find out what the problem is. Probably there's a problem somewhere, because we've just been consistently and consciously following up my ovulation and fertile days, right? So that was when I went to the hospital, a very big, renowned private hospital here in Abuja. I may or may not disclose its name, right? So we had to go to this hospital because we've heard they do well. Even foreigners go there for treatment, for tests, everything at all. So we had to go to this hospital, and I had to go first, right? So I went to the hospital and I spoke to the doctor. I told the doctor said, what are you here for? You know how normally you go to the hospital and you say, I have headache. I came to probably get medication for the headache or anything, and they said, okay, go and run this test. I was very sound, very okay. And I came to the hospital, so it was time to go and see the doctor. And when I went in, the doctor said, what is the problem? I said, doctor, the problem is that I've been married since 2020 and I've been trying to conceive, right? But I've not been able to take in. And she said, okay, fine. You just ask you questions. What does your partner do for a living? I explain. What do you do? I explain. So she now asked, okay, how often do you see your period? And I say, I rarely see my period. I could stay and then in 2 months I don't see my period. Let's say in the third month I see my period. The next 2 months I skip. The third month I see my period. So I've just been having irregular menstrual cycle. And mind you, I have always known I have a regular menstrual cycle, but I did not pay attention to it because I felt it was a blessing in disguise. Because you know how when your period comes, you're worried about getting stained, you're worried about your mood swing, you're worried about pimples coming up on your, and all these period cravings. Whenever I see my period, right, I don't have cramps. So that's why even till now I can't relate to when ladies say I have cramps or I'm cramping my stomach. I don't experience that. So I explained that I rarely see my period, so like it's just very scarce. So she said, okay, that's fine. How about headache? I said, any little thing, if I stress myself, stress is relative, and the way it's relative to me is that if I wake up in the morning and I even sweep the house and wash plate and do anything and I've not had anything for breakfast, I'm going to have terrible headache throughout that day, and it just affects me just one side of my head, not even my entire head, right? So I explained that I usually have this very terrible migraine, right? So in addition to that, I've had black and dark. Which one is darker? Like, which one is blacker? So I've always had black or dark spots on my face. Like, my face is just a mess, and a lot of times I get organic creams. Like, I'm high on buying organic. If I just see any advert and they say it clears pimples in 7 days or even in 3 days, I'm definitely patronizing that person. I'm buying that cream. So that was my situation at that point in time. My face was just so messy What else? And I noticed hairs, like just one hair always coming out on some parts of my jaw. Like you could even literally see, probably camera is just making everything look nice, my chest, my back, just dark spots, and it was just very, very horrible. And at some point in time, I usually have this fluctuating weight size, right? I could be very fat this month, like I'm looking very, very plump and fat, and then the next month I'm just looking like I've gone through a lot. I'll just slim down. The next month I'm looking normal and moderate. The next month again, just this fluctuating weight size. So it was based on, I didn't tell her this things myself. She was just asking me based on her analysis. She said, okay, do you have headache? Do you experience headache? And you know, because I came there hoping to know what the problem is. I just have to open up and tell them in detail. I had to explain, yes, this is the nature of the headache I usually experience. She said, how about your face? I explained also my face, my skin, my back, everything. Then stress as well. Stress level is just very, very, very high. So after all this explanation and everything, she now said, okay, fine, based on what you've said so far and based on the question I've asked you, I think you have PCOS, but we are not going to conclude yet. So I'm going to send you to the lab. You go to the lab and then you run tests. So after the test, we can now determine if you actually have PCOS or not. And at that point in time, I'm like, I don't understand. Which one is PCOS, right? So that was sent to the lab, and then the lab said, okay, whenever I have my period next, like the next time my menstrual cycle, my period comes up, right? The next time my period comes up, I think either on the first day or on the last day, I should come back to the hospital so that they'll run the hormonal profile tests on me. So I had to wait. The next time I saw my period, I immediately rushed back to the hospital and they had to run the test. So after running the test, the results came out, and based on the results, they said my hormones are not balanced. So that means I now have hormonal imbalance in addition to the PCOS. And I felt like, what is this? Like everything was just sounding like HIV/AIDS in my ear, because I felt like it's only HIV/AIDS patients. I'm sorry, it's not like I'm shading them or anything, but I just know that it's only that sickness or that health condition that scares a lot of people, But this one is now sounding like it's a death warrant. I don't know. It was just sounding so Greek, and I felt so bad. So they said, okay, I should come back to the hospital much later. And when I got home, I had to start browsing. I was browsing, what is PCOS, what is hormonal imbalance, what causes it, what does this, what does that. So it was in the process of browsing and everything, I came across Maraji's video or something. I don't know if I'm getting the name rightly, Maraji or something. She's just a very renowned YouTuber based in Ghana. So I came across her video, how she got pregnant even amidst having PCOS, and everything she was explaining in the video, I could relate to it. I said, Jesus. And you know, if you watch her video, you see where she even dropped drugs and supplements she took, like she just got and took herself and used it to treat herself. I'm like, I don't understand. So we are on the same table, like myself and her. Did it get to this point? And I was so worried. I was so worried. I literally slept on YouTube throughout that day. I was watching a lot of videos, checking a lot of things, and I felt so bad. At some point, I'm even watching the video and I'm crying and I'm feeling so bad and I'm crying and I'm feeling so bad. So the day I had to return back to the hospital to see the doctor with my test result and everything for that medical advice and then medication, I went with my partner, and then when we they called both of us in, and they even had to run tests on him as well to check if he's potent, right? Yeah. So when I went that particular day with my partner, the doctor called us in, and I just hated that particular environment and feeling at that point in time, because I felt like, what advice do you want to give myself and my partner in the hospital? That, like, it just felt so strange and weird. But we went in, and then the doctor was explaining, this is what PCOS is, this is out of I'm just trying to, let's say, randomly approximate or randomly remember or recall. So they were like, out of, let's say, 100%, out of 100 women in Nigeria, 70% are PCOS, either 70 or 60 or 50. I can't remember exactly, so don't quote me. But the percentage was just high, have PCOS. And I'm like, Jesus, but we've not been, like, nobody told us this thing. We've not experienced it before. So how come I'm hearing it for the first time and it's looking like it's a big deal? It's actually a big deal, right? So after his explanation, the whole thing was making sense till he now said, madam, the thing is that chances of you giving birth or conceiving is 50-50. It was at that point in time and I said, okay, now that I get how extremely serious this is. Because remember, I went to the hospital because I've been trying to conceive and I've not been able to get pregnant. So I just got so worried at that point in time, and I'm like, no. At this point, I think I have to pay attention because this is serious. So you now said it's 50-50. You may eventually take in, you may not. But even, you now started mentioning all these eggs, all this IVF, this, that. My head was full. So after everything, he said, don't worry, by God's grace, we're going to do the things we can do as humans and as medical doctors, and we'll see what would happen. Then I said, okay, just go downstairs, meet them downstairs, they'll give you your medications and tell you when to be coming for your injections and everything. I'm like, okay, fine. And we went downstairs hoping that, let's say, just medications, just these small tablets now, they just give it to me and I go my way. And we went downstairs, our bill was 200,000 naira. No cap. This is just it here on the screen for you. So our bill was 200,000 naira, in that, which includes not more than 5 drugs. And mind you, one particular tablet was even 30,000 naira. The other one was 70,000 naira. I think for 3 injections. And they say I have to be coming to the hospital for 5 days to take that injection, right? At the IVF unit of the hospital. Hey, everything was sounding like, Jesus, God forbid, God forbid. You know how people are saying, you just know how the lecturer will enter the class and then when he's teaching, he says, more than half of you will fail my course or will not pass my course. And you're saying, God forbid, God forbid, God forbid, God forbid. And you may eventually end up failing that course. So that was how I just felt at that point in time. I literally, and I think when I saw the bill and they were now explaining the injections we should take, I will come and take, and the drugs I'll be giving. It was at that point in time it now got dawn on me that, okay, this is now more serious than I have been thinking. Do you get? So at that point in time I was crying and I was not crying like I was crying. I was literally crying and crying. Like, it had to take the intervention of my partner and my parents, because my partner had to call my parents and then inform them, and then just my parents. Now my dad was proclaiming positive words to me. My mom was saying I didn't go through, I didn't have any problem when I was giving birth, so you two will not have any problem. I should not worry. This is what they are saying as humans, but God has not said it. God has blessed me. God has blessed me. Hey, all those things, the thought of even like the feeling of even hearing this thing from them even made me feel extremely bad. So I just felt so bad. But I had to carry on. In short, when we were driving home that day, I felt like, can I just run away from here? Can I just open this car door now and just run away? Because what's the point of being a woman or being a lady and you would not be able to conceive? And even if you be able to conceive, it's now a 50-50 chance, or it's now not that probability. Like, how does that, what does that mean? How would it sound to the next person that hears it, right? So that was it for that. And that was when the whole pressure now started kicking in, because that was 2021. Remember, we were married 2020. And then sometimes some friends will call in and they're like, Success, how are you? How is everything? When are we expecting baby? Thank God for phone calls, because a lot of times when people ask me that question, my mood just suddenly slides down and it switches immediately. And you can't see people's facial special expression over phone calls, right? And my facial expression just changes immediately, and I feel so bad that this person is not because that person is asking me that question alone, but I just feel so bad that so it has gotten to the point that people are now asking me this question, right? So I will just feel so bad, but I'll just laugh it off. Sometimes some people even ask me, success, when are we expecting the baby? When are this? I say, no, hold on, no, I'm taking my time. Let me enjoy marriage. Then enjoy what? I was looking for solution to my problem. I was just saying all those things to cover up. I'm sure a lot of you that ask that questions, if you're watching this video now, you would now relate to all those calls and all those text messages you would send and everything. And I would just be posting things on my status to make myself happy. A lot of times I'll just make up, look good, record a lot of videos, and I'll just be looking happy. I just try to get those things off my mind, right? Especially because I did not continue with that medication from that hospital again, and still I didn't know what next to do. So during that period when we came back, I was so bored that I was disturbing my partner. What can we do? Should we just go ahead and take the medication and just see what the 50-50 chance would give us, and hoping that God will just help us? While taking the medication, I will take it and I'll get pregnant. So I was like, don't worry, just calm down. Let me ask some of my friends. I remember one of my friends got married, and then for 3 years he didn't have a child for 3 years after getting married. And when they went to the hospital, that himself and his wife, the doctor recommended some drugs. So I'll just talk to him and let's see what will happen. And then he spoke to his friend. The friend had to connect his wife to us, and then we spoke with the wife. So I remember this particular day when I summoned courage. It was at night, so I just told my partner, please, you do the calling. Do you get it? Because I didn't know how to open my mouth and tell people this is what I'm going through again. So I told my partner, please, you do the calling. So when you call in, just initiate the talk. Tell her this is why you're calling in. Then along the line, tell her your wife is here so she can speak. Because I felt so weird starting that conversation. It just felt so weird, right? So grateful enough, he called, and then he spoke with her, introduced himself to her, and then she was so excited to even share her experience with me. So I remember one of the first things she said, when he mentioned that we've been trying to conceive and it's not been forthcoming, and then this is our problem, she just laughed. She said, don't worry, that will be a story very soon, that we should not worry, it's not a big deal, I'll get pregnant. And she said that, and I'm like, wow, okay, fine. This woman, I think she has experienced what I experienced, I think. So saying this thing means that there is hope, right? So when we got, when I got on the call with her, I had to, so she didn't even allow me to say so much. She just said, in her dialect, because I'm Igbo, she said, okay, I have that. She said, actually, if you don't know, what you have is PCOS. They normally call it hormonal imbalance. So when she said that immediately, when I've not even mentioned or said anything to her, I just said, thank God. I think this woman has gone through this thing true, and she understands, right? So she just said, this is your problem, this is what you're experiencing, this is what you have, but the solution is not a problem. She just said, don't worry, I'll just tell you one drug. When I went to the hospital, the doctor just said I should take this drug, and then after taking this drug, after some time, I was able to take it and I got pregnant. I was so happy. And she said it's not even that expensive. It's not up to, I think, 7,000 naira or so, right? She now said, okay, I should take that drug. I was just so excited and so happy. And then she mentioned the drug. Please comment down below if you think it's safe for me to mention the drug she advised me to take. Else, you would have to ask me on my Instagram handle. Check my Instagram, chat me up there, and then I can tell you the drug, just for telling sake. And I would not advise, in the course of this whole story, please, I would not advise you to self-medicate for any reason. Do not self-medicate, even if it is abo, herbal bitters, anything bitters, anything. Even village people will even tell you, even call you, they'll tell you this is what you take, or this is all the leave, you do this, you do. Don't. I know you'll be so desperate to get solutions to your problem, but please never you self-medicate, and never you take any local, because you could take all these things and nothing will happen, and then the day you take the drug that would make something happen, everything will just counteract and clash and just mess up the whole thing, and you would rather mess up your system and still you end up not getting solution to your problem, right? So that was when she advised I should get that particular drug, and trust me, I had to go to Wuse. I had to go there, one renowned pharmacy there. I went there and I got the drug. I think I got it for about 3,500 then, right? So I got the drug. And then that's one bad thing about self-medication. When I got the drug, she said I should take it one I think every day, right? Very tiny tablets like this, one every day, very tiny tablet like this. But trust me, do you know that one I will take? I usually take it in the morning. When I take it in the morning, as tiny as that tablet is, I'll take it in the morning. I will eat. I will eat. Sometimes I will eat and I'll be wondering where this food I'm eating is going into. I would eat, and after eating, I would sleep. I would literally sleep and forget myself. Like I would just literally forget and sleep. You could even break in the door, come into the house, carry everything, carry me, shift, carry me through, do everything, and I'm still sleeping. That was how bad, like the let me say the influence, is it the influence or the effect? No, the effect of that drug. That was just how strong it was back then. And then that was how I kept taking that drug. And she said, she said, as you're taking this drug, I mean the woman, right? That's my husband's friend's wife. She said, as I'm taking this drug, that I should also be watching myself. So once I notice I'm pregnant, I should discontinue taking the drug, right? So that was just her advice, just discontinue taking the drug. And I'm like, okay, fine. And I was just so optimistic then. I will not even miss this drug for any reason and any day. I was just so optimistic that this drug is finally the solution to my problem. But guess what? While I was taking this drug, at some point in the month of June, I think I'll just have to, if I say the wrong date when I'm editing this video, I'll just put the right date on the screen, right? So when I start taking this drug, I will tell you when I start taking this drug, I'll put it here, and then when I start taking the drug, yeah, I'll put the date here. So when I start taking this drug, at some point I did a test and I noticed I was pregnant. So I was so excited, just that drug. And then one thing she also made me realize was that drug also will balance my hormone. It will restore back my menstrual cycle. You know, if your menstrual cycle, if you don't know your menstrual cycle or your menstrual cycle is not there, you don't even know when is your ovulation date or your fertile date, you get. So that was one of the major impacts or even the major work of the drug, right? To restore back my menstrual cycle that has always been irregular, and then also to balance my hormones, right? And then she also mentioned that she thinks the PCOS or the hormonal imbalance that in my own case is high level of prolactin, right? And you know hormones now from secondary school, yeah. So I was wondering, I don't have big boobs, so how come I have excess prolactin? Well, medical doctors, please comment and tell us how all these things happen, right? So realizing I was pregnant, right? When I was taking that drug, on a particular day, I was so feverish. I was very sick. I was very feverish. I was feeling just so unusual, and it was not something I could manage. So that night, my partner carried me to the hospital. Went to a private hospital, another private hospital, right? Because I was thinking it's typhoid or malaria. We went to that private hospital. This is prior to getting pregnant, right? Please don't mix up the story. So we went to this private hospital, and when we got there, the doctor asked me a few questions. Are you feeling feverish? Are you doing this? So the doctor now said, okay, he doesn't want to give me malaria drugs yet, right? So I should, because on that night, he said I should go back home very early in the morning. I should do a pregnancy strip test, right? And then after the pregnancy strip test, if it's positive, then I should come back to the hospital. If it's negative as well, I should still come back to the hospital. So I said, okay. So we went home that night, and then while going home, we bought the strip. And then in the morning, I did the test, and it was positive. Like, it was clearly positive. I was so happy. I was very, very happy. I was so excited. I was even eager to run back to that hospital that morning immediately. So we went back to the hospital, and the doctor said, okay, what happened? How was it? How was the test? I said it was positive, and he was so excited. I said, congratulations, ma. I said, thank you, sir. Congratulations, sir. He congratulated my husband. So that's how we collected congratulations that day. And then he now said, okay, maybe it's just the symptoms and signs of any pregnancy that is disturbing me. So that's why I'm feeling sick, or I'm feeling the way I'm feeling. And I relaxed. I was just so excited. I said, anything it is, thank God. I'm relaxed. I'm being no need to feel about it. And that was how I got so relaxed, and I was watching myself. But let me tell you the sad thing about that pregnancy. I lost it, and I will still tell you the reason why I think I lost it. And I'll keep on emphasizing in this video, do not self-medicate. Don't self-medicate, please. And then, how did I lose it? When I was pregnant that period, it lasted up to 3 months. And when I realized I was even pregnant, I think I was almost close to 3 months when I realized. So that means that drug I started taking, I was pregnant the first month and I was still taking that drug, and I didn't know I was pregnant. I was pregnant the second month and I was still taking that particular drug that my husband's friend's wife recommended to us, and I didn't still realize I was pregnant until, I don't know. So I feel deep down that probably the drug and my pregnant situation or condition, they were just clashing, because that drug was just, the effect of that drug was just so much on me. It's the sleep, hunger, everything. And imagine that as tiny as that drug is, it's balancing my hormones. So imagine how it will counteract with pregnancy and everything. So I was just feeling just the pregnancy and the drug and everything is what made me lose that pregnancy, right? I mean my first pregnancy. So I didn't even know back. So I was so excited. 3 months, I was close to 3 months pregnancy. I was close to being 3 months already, and I went out. I told my partner, take pictures of me. I took lovely pictures. If you see amazing pictures I took, very beautiful pictures. And if you see me then, you even realize I'm pregnant. This I was looking very, very beautiful. And then I took very beautiful pictures. After taking the pictures, the doctor now said, I remember that time we went, the doctor now booked that the next time I should come to the hospital. He gave me the particular time I should come to the hospital. And that particular time he said I should come to the hospital, I would be exactly 3 months the following day, right? So I went to the hospital. I was so excited, so happy. So the day I was to go to the hospital, I started feeling sick again. I said, oh, maybe it's pregnancy sickness now. So we went to the hospital. When we went, the first time before they rebooked me and the doctor said I should come back, he had to run a scan on me. So when they did the scan, they said the baby was not viable. That's at 2 months. They said the baby was not viable. I'm like, I don't understand that word viable. What does it mean? They say the baby, we're trying to see if the baby is alive or the baby is not alive. So we can't exactly determine. So come back so day. So that was why I was supposed to come back just a day to being 3 months pregnant. So I prepared that day for my next hospital appointment, and I went with my partner to the hospital. And then when we got there, we had to do a scan again. They said they are not seeing, like the baby is not viable, and they're not sure what they are seeing on the results. They referred me to another lab. I went to that lab. The doctor was doing, when he was running the test on me, so I went to that lab. When the doctor was running the test on me, he was just doing that. I just felt like, is pregnancy test not something that when you come in, they just see immediately inside your womb that there's a child there, and they just tell you, oh, congratulations, everything, and you just go your way. So why is this one doing like he's confused or he's not seeing the baby? So at some point I had to tell him, please, I'm sorry, can I call my husband in? He now said, yeah, no problem. So my husband came in, and my husband was there. So he told my husband. So it was even doctor that was now asking me, are you pregnant? And I'm like, I don't understand. She came here for pregnancy test. I mean, the lab scientist. I'm like, she came here for pregnancy test. Why are you not asking me if I'm pregnant? Like, are you not seeing it on your screen there? And then when he was checking, he said, I can't exactly explain what I'm seeing. I can't, like, the result is not clear. The baby is not, but according to the scan, you're actually 3 months pregnant. But what we are seeing here is not, like, it's not just clear. It's not making sense. But don't worry, regardless, we'll do the scan. When you now get to the hospital, you can give the results to your doctor, right? So I said, okay, fine. And he did the scan. My business was that, thank God, you say, okay, I'm 3 months pregnant. So if you like see, if you like don't see, all I need is I'm pregnant. So we took the result back to the hospital, and the doctor was just acting like he's not even sure of his profession again. Because the way he was looking at that scan result, I was worried. I said, why is this man behaving like he does not understand his profession again, or he cannot interpret scan result again? He was just looking at the results somehow, and it was even making me feel bothered, and I was so worried about his countenance and everything. So said, okay, the thing is that I think you should just go home, come back on so day. He just gave me another date to come back. Said, but I'm not comfortable with this result. In fact, he was even looking at the result like this, like something that you could just look at like this and you just understand. You're not even looking at as if when you raise it up like this, you see my womb and see the baby and the baby will tell you, yes, I'm here. Like the whole thing was just so, it was even almost pissing me off, and I was already so excited then that I'm finally picking him. So I left the hospital that day, and my hope was just 50-50. I was just feeling like, I don't care. Based on what this doctor is saying, he's not good. Do you get? So I don't care. And I left the hospital. Immediately I left the hospital and I came back. I came back around 12 o'clock. That was on a Saturday. I came back around 12 o'clock. When I came back, I was feeling pains in my belly. I was feeling so uncomfortable. Like I was just feeling hungry. Just hunger pains. At some point the pain was now pinning me so much that I could not stand erect again. I had to bend down. At some point I had to kneel down. So, and my partner was not around. He just stepped out and went to work. And I'm like, this is unusual. This is unusual. At some point, I felt like urinating. I could not hold the urine again. I now saw a droplet of blood. In my head, I'm like, I don't understand. What is this? And I was seeing it. The next minute, my stomach started paining me. It just felt like needle was just choking me everywhere. And I could not breathe again. I was just saying, Jesus. Do you know, brothers and sisters, before I could explain what was happening with me, I was already in a pool of blood. Like I was sitting down and crying and shouting and almost tearing myself in a pool of blood. At that point, I had to, with my last strength, just shift my phone, dial my partner's number. I told him, please, wherever you are, just come back. And as God will have it, his workplace is not far from home. He came back in. So even when he came back, the door was open because it's not been long I returned from the hospital. The door was open. So immediately he just came back. He was saying droplets of blood. He came inside the room and saw me in the pool of blood. Like his exclamation, when I even heard it, it was so hot. He asked, what is it? What is the problem? I told him, don't come near me, don't touch me. Like, he was just feeling like if he comes near me, it's even him that is making the pains continue. I said, don't touch me. I was so aggressive, very aggressive, and I was in so much pain. I was shouting and screaming in so much pain, and that was it. I didn't even know what was happening then. I couldn't even interpret like what exactly I would tag what is happening. I just know I was bleeding, and at the end of bleeding and everything, when I was able to calm myself down and everything just subsided for some time, he now said, okay, he was now cleaning the environment or cleaning me up as well. And as he was cleaning up and doing everything, I was trying to get strength back. I was just trying to recuperate and everything. So after some time, when I was able to get myself back, I just sat down there. Said, just relax, just sit down there. So when I sat down there, I kind of relaxed. I now felt this little urge to just pee while sitting down there. It was just like I wanted to pee. Pee is not stressful now, so I just felt like peeing. And then when I peed, I just realized, I just felt like, I just peed. And then while he was cleaning up, he came back again to continue that, to finish up the cleaning. And he saw a very big lump or clot of blood. So when he now saw it, he now said, thank God. And I said, thank God what? He now said, don't worry. And I said, no, tell me, why are you thanking God? He now said, open your leg, and I spread my leg. He now brought out the clump, very big like my palm. So he now brought it out. He now said it has come out. In my head, I'm like, what has come out? Like it just felt like, what is even wrong? What is happening to me? What is wrong with me? I could not literally understand at that point in time. And then He just said, don't worry, don't worry, don't worry. So after some time, I overheard him speaking with my mom on phone. Next thing, I overheard him speaking with the doctor on phone. And I was asking, what are you saying? Why are they calling you? Why are you calling them? What are you people saying? He said, don't worry, let's just go to the hospital. The doctor just said I should bring you to the hospital immediately. Hospital that I just left 2 hours ago. I'm going back there. And I said, okay. I could not even wear any dress. I just felt like, please just carry me naked like this and take me to the hospital. Not saying, no, just find something. We'll just find something and wear. I said, no, I don't want to wear anything. And just carry me like this and go. So he just had to get one of my dresses and then wear the dress on me. So when he wore the dress on me, I just managed to get my feet and then I stood up and we went to the hospital. I was even lying down in the car. So when we got to the hospital, immediately we got to the hospital, it was as if doctor already knows, like he had already spoken with the doctor and they know what is wrong with me, so they just wanted me to come. So immediately we just came, the doctor just said, just come in, and we went in. And when we went in, the doctor now started explaining. He was not explaining to me. I was thinking it was both of us. He was not explaining to me. He now said, the thing is that even when I saw that scan result, I was not comfortable with it. Even when I were complaining of all these pains you were feeling in your stomach, I was not comfortable with it. So the thing is that you just had a miscarriage. So we're going to give you a drug you put under your tongue. So if by tomorrow, which is Sunday, the blood, like you're still bleeding, you have to come back to the hospital and we'll evacuate. But if you're not still bleeding, then we just have to give you medications you just be taking. When he was saying that thing, I almost slapped him. Like I literally almost slapped him, because in my head I'm like, are you stupid? What are you even telling me? What? But when we were on our way to the hospital, I was not telling my husband, why am I feeling all these pains? I finally gotten pregnant. What is wrong? What was doing? He was just so quiet and I was just wondering, listen, just calm down. Let's get to the hospital first. At some point, I said, anything the devil is planning against me, his plan will not work. Anything he has in mind, his plan will not. This pregnancy I'm finally taking in like this, nothing will happen to me. So it was when we were close to the hospital. He now said, babe, can I tell you something? I said, yes, I'm listening. He now said, the thing is that we lost the baby. And we're already close to the hospital. When you say that we lost the baby, I say, I hope you are not using your mouth to say what will put you in trouble. I just ignored it. I did not pay attention to it. It was when we were waiting and the doctor saying it. It now made more sense to me. I was just waiting for him to finish, the doctor to finish saying everything he was saying, so that I will stand up there or sit down there or lie down there on the floor there and start crying. So that was just my condition then, and I was feeling so bad, very, very swam. But it just felt like the whole hospital, the whole Abuja knows what happens to me that particular day. But by the grace of God and with the support of my husband as well, we were able to come back. We came back. While coming back, he had to get fruits for me, buy a lot of things for me, and we came back home. And that was when the main depression now started, and I felt like, Jesus, I finally got pregnant and I still lost it. So why am I now alive? What am I now doing? And how am I sure now that the next one I'll not still lose it again? Like, what was now the point of attempting? I felt so bad. And the following day was Sunday. I went to church the following day. Funny enough, did I? I think I did. Everything was not making sense to me again. Everything was not making sense to me again. I just felt so, and then it just felt like everybody in the whole world just got to know that particular day that something terrible happened to me. I felt so bad. But after the miscarriage, that was when I had to swing into full action and go in search of the cause of my problem. That was PCOS and hormonal imbalance, and find a solution. And it was this second stage of intentional action into the cause of my problem and finding a solution to my problem. It was in the course of this second stage that I got pregnant. Like, it was a full and complete pregnancy. So at this point, this is the first half of the story, right? So in my second video, I will tell you in detail, because that is even the main meat of this video and story. I'll tell you in detail how I was finally able to get pregnant. And who knows, maybe by God's grace I'll give you birth. No, not maybe by God's grace. Who knows? You just have to keep following this video, because this baby definitely has come and will come to stay and is going nowhere. So you have to follow this series throughout, because this is a very huge and big testimony. I'm telling you, a lot of people have these issues and they don't. You keep on going to probably to fetish doctors, native doctors, doing personal medications or self-medications without knowing that just one thing, you're not even infertile. Forget all these things people are telling you. You are not infertile. Everybody that's told that you cannot give birth is a lie. Do you get? Yes. So just doing the right things, and this right thing I did is the reason why after doing just this singular thing, and I was able to get pregnant, like full, complete, normal, beautiful pregnancy. And I felt like, are you sure there are no other persons like me out there that are even going through things that are not even as heavy as what I went through? And yet 5 years, 7 years into marriage and they are not pregnant yet, and they are crying and doing this and doing that, when the solution is in there, it's even around them. So please do well to share this video to your friends. Don't even, at this point in time, it's not only women that should watch this video, because a lot of women, when you're so depressed and in a very tight and difficult condition, you may not even be open to advice or correction or anything again. So you can share this video with your friends, male, female, even young girls, because I'm sure if I was able to check my hormonal profile earlier enough, let's say around 2019, if I checked it and I realized that I had hormonal imbalance, I would have started treating myself earlier. Do you get? So thank God, God doesn't come late anyway. Thank God I treated myself and I found solution when I did. So please do share this video with your friends, your family, everyone around you. People need to watch this video. Follow this series. Throughout this month of December, I will be sharing my experience with you. Please do not miss any of these videos. After this video, the next video would be explained. I'll tell you in detail how I finally got solution to my problem, the drugs I took, the test I did, everything. You would get to know it firsthand. This is actually a new era for me, and I would love to carry you all along. So thank you so much for watching my video. Do not forget, as usual, to subscribe. Don't forget to like. Don't forget to comment. And don't forget to thank God with me and for me. So I'll see you in my next video. Bye.